All right, good evening, everyone, and thank you very much for taking the time to brave the elements and come out tonight to learn more about a very compelling and important subject about the future of healthcare in Lakewood. The fact that you're here demonstrates your concern and your interest in all the issues that are before us, and I thank you very much for that. Now, for a show of hands, just so we can make sure we can make best use of our time, how many of you attended the meeting at the Beck Center on the 28th? All right, so about half. All right, that's helpful. And we don't want to spend time redoing what we've already done to the best that we're able, but that means half of you need a brief recap, and that's important too. By the way, my name is Mike Summers. I serve as the mayor of Lakewood, and in my capacity as mayor, I am one of 23 trustees of the Lakewood Hospital Association, which is a private nonprofit corporation which was given the authority to manage the operations of the hospital in 1986 by a vote of the citizens of Lakewood. At that point, it ceased to be a public hospital and became a private nonprofit corporation. And as many of you may remember, in 1996, an agreement was signed with the Cleveland Clinic Foundation, the trustees of the Lakewood Hospital Association, and the city of Lakewood that chartered a three-party agreement for a 30-year operational agreement. And that agreement expires on roughly December 2026. Now, I would like to take a moment to introduce the trustees of Lakewood Hospital Association who worked hard starting in 2011, vigorously in 2012, picked up a huge amount of steam in 2013, and came to agree to a recommendation on January 14th, 2015. And that recommendation was introduced to the community on the next day, the 15th. And we had our first session on January 28th. This is the second. Our third will be March 10th. That's a Tuesday. And we'll get an April date when we get a little closer to that point. In addition, City Council, who has the responsibility ultimately of approving a new definitive agreement, which has not been drafted. That's in the process of being drafted. And that's the details of the letter of intent that it was agreed to by the Lakewood Hospital Association, the Cleveland Clinic Foundation, and the Lakewood Hospital Foundation. Three parties. City Council was not party to this letter of intent, but they have the issue before them and are awaiting a definitive agreement, which, as mentioned, has not been drafted, is in the process of doing so. But in the spirit of addressing the issues, they have taken upon themselves a series of conversations through their committee of the whole, which is all 7 members. And there's plenty of information available on the city's website, but I think pretty brisk pace, one a week or for really the next 10 or 12 weeks, if not more, whatever it takes. Now, the trustees of Lakewood Hospital Association, if you'd be kind enough to stand. There's, I think, about 10 of you here today. These are the folks that are members of the association. They got there by either an appointment of the mayor, me or previous mayors, city council, current or previous city councils, and or the community at large and the Cleveland Clinic. There's 23 of them, and they represent their views, and they are prepared tonight to share their views as well as the conversation starts. So thanks for being here, folks. And I would say they took their responsibilities seriously. They understood that they had a duty of care to the patients of Lakewood Hospital. They had a duty of care as an employer, and they took that as a most sacred responsibility, and felt not only did they have to identify the future and its challenges, but also provide a solution, which they have chosen to do, and that's the issue that's before us tonight. So tonight, we will not do as we did on January 28th and cover the landscape of all the issues. Tonight, we are going to particularly focus on 2 major themes, one of which is what is the current trajectory if we do nothing as a hospital in Lakewood. And then the second major point is, more specifically, what were the 10 options that were considered by the trustees? Lisa Fry is with us. Lisa represents Subsidium Corporation. Subsidium is a consulting firm focused on healthcare delivery, strategic issues across the country. They reside in Atlanta, and they were basically employed by the trustees to help guide them through this as a very increasingly complex world of healthcare. And expertise, knowledge, experience were all very important so that the trustees could get to the essence of the challenge. and understand what are facts, what are not, and sort out the issues that were before them and make recommendations. So Lisa will be our primary presenter tonight. She's going to take about a half an hour to cover what happens if we do nothing, and then what were the 10 major strategic options that the trustees considered in more detail. At that point in time, we will open the floor to comments and questions. We will close our session tonight at about 9 o'clock. Those of you who were there on the 28th know it was a pretty long evening. We finished about 10:15, started promptly at 7. We don't have to do this all at once, folks. We're going to have many, many conversations, so we're going to try and be respectful of your time and our energy and stay to the 2 hours tonight. But we will convene in this room on March 10th, Tuesday. But Dr. Jones is going to present sort of a snapshot, a preview of what happens in a family health center. And that's really an introduction to the March 10th conversation, which will be much more details about what a health center does. And we'll have a chance to hear firsthand from clinic folks who are operating and working in those health centers and other places in our region. And we'll get really a more comprehensive understanding of what that means to healthcare delivery for us. In addition, on the March 10th meeting, we'll begin to put a little more flesh on the bones of the Wellness Foundation. Put some flesh to understanding what that looks like, what it could do for us, and how we might go about organizing it. And those decisions are definitely ahead of us. So, just a quick reminder, the proposal that the trustees recommended was that Cleveland Clinic would build a $34 million, 62,000 square foot outpatient family health center on the current footprint of Lakewood Hospital. It would include an emergency department. The clinic would purchase 2.5 acres of land of that 6-acre parcel at fair market value. It would include the creation and funding of a $32 million wellness foundation to be run by the community of Lakewood for the benefit of the community of Lakewood. It would include creating 4 acres of developable land on the current 6-acre site, the other portion of the land that's there. It would include an $8.3 million payment to the city of Lakewood as a result of the sale of 850 Columbia Road, which is a medical delivery facility owned by the trustees of the hospital. And there are various other elements, but those are the broad strokes to give you a sense that we're going to create something new that's outpatient focused, that in the opinion of the trustees is more aligned with a competitive cost of service to address what our community needs, which are chronic conditions, generally based on lifestyle choices. And those include things like diabetes, chemical dependency, such as alcohol and drug dependency, tobacco, cessation and dependency issues, mental health, and other pulmonary issues caused by generally smoking and or asthma-related issues, most of which, or almost all of which, have a portion or a significant portion of their care which is delivered on an outpatient basis today. And so there's much to know here. I would like to address one common concern that did come forward at the January 28th meeting, and that was the question of transportation. It's a very, very important one. And the question was, if we have services that no longer exist in Lakewood, and I don't have a car especially, how would I get to these services? And it's a little bit of a complex question because really it depends on which services you're talking about, because a substantial amount of the current services delivered through Lakewood Hospital, about 90%, are currently delivered on an outpatient basis. And those services would actually remain in Lakewood. Now, the portion that are delivered on an inpatient basis are the ones that would not be in Lakewood ultimately. And those are the questions that may need some transportation issues. But I would say if you're a senior citizen today, and if you're like me, 60 years or older, you would qualify for the transportation services through our Department of Aging. We have several buses that run medical routes, and I think we can organize these things to effectively address the transportation questions for senior citizens in Lakewood. We also currently have cab vouchers that for those who qualify, we are able to provide a voucher that essentially lets the patient or the client get services that meet their schedule and their destination. And those can all be expanded. And I think if you're a person who has a disability perhaps and uses transportation, I guess we'd like to know more about what you're doing today it's likely you may not be taking the normal bus transportation, maybe paratransit transportation. That would not go away. We believe we can engage in some vigorous conversations with Regional Transit Authority, perhaps using some of our newfound resources that might be in the Wellness Foundation to re-engage in some conversations about their partnership to meet needs in a community like Lakewood. But I think we all understand that access to health care is the most important element of prevention. And whatever we do, we must not have someone who has a need for access, and transportation is the barrier. That has to be addressed and eliminated. And I think we're all committed to doing that. So whatever issues we have before us in terms of transportation, I think please accept the fact that it's a challenge, but it's imperative that we address it and solve it. And we're committed to doing so. So I'd like to turn the conversation over to Lisa. And she's going to start with two subjects, one of which is current state of the hospital financially and its performance and its trajectory if we do nothing. And then the second, of course, is the 10 strategic options that were considered. So, Lisa? Excellent. And we'll save questions to the end of Lisa's her presentation. I don't know, do you sing, Lisa?
I do not sing. Definitely not.
Tap dance, maybe? Anyway, Lisa will end her presentation, and then we will open it up to questions. And then at the end, we'll hear a little more from the Cleveland Clinic and Dr. Jones. Fair enough? And by the way, just a reminder, and I'll remind you at the end, when we go to questions, we're going to ask you to go to the microphones, and that's because this too is being recorded by Cox Cable. Matt is in the back, and by addressing your questions to the microphone, we're able to get it recorded on the video presentation. You know, the January 28th presentation is on the city's website, and for those of you who just didn't get enough and wanted another 3-hour shot, it's there to be seen, and this one will be there as well. So, Lisa?
Thank you, Mayor. I'm Lisa Fry. I'm a partner with Subsidium Healthcare, and as the Mayor said, that we're a healthcare-specific strategy consulting firm based out of Atlanta, Georgia. We were engaged by the Lakewood Hospital Association Board of Trustees in July of 2013 to help them begin to think through the strategic options for the future of the hospital. And so happy to be here tonight with you all, and pleasure to be invited again from last time that we spent together as well. So as the Mayor said, I'm going to focus tonight on some of the facts and figures that the board took into account in coming to this recommendation. So as you all know, whether you're in healthcare as a profession or whether you're a user of healthcare services, it's a complex business. And so what we're going to try to do tonight is boil it down to some of the facts and figures and information that we felt was, at the end of the day, most relevant to the decision-making process. So that's where we're going to spend some of our time tonight. So we're going to talk some first about what's going on in healthcare overall around the notion of inpatient services. And so we're going to talk some about national trends and what's happening here and how those are similar or not. And then we're going to talk about what that really means for Lakewood Hospital. And we're going to look a little bit into the future. I think, as the Mayor said, a lot of folks have questions about what would happen if we just continued on the current path, and why isn't that something that we can do? So we're going to try and talk a little bit about that tonight as well. And I think what we're ultimately going to get to as we talk about all the options we considered is really, at the end of the day, you all as a community, first the board that you elected to represent you, and then your council is going to be faced with a decision about what is the best use of your precious resources in your community. You've got a certain amount of money and resources and time to invest in providing the right types of healthcare services for your community and for your neighbors and yourselves. And we're going to give you our perspective as a healthcare consulting professional, and seeing a lot of different markets across this country on, sort of what are the better places to make your bets potentially than others in the process. So that's what we're going to do tonight. So unfortunately, as many of you hear about, I'm sure people hear even in this community about hospitals that have closed down, and oftentimes these days, unfortunately, the economics of healthcare are quite harsh. And so we're going to talk a little bit more about that. So the first thing, and that was a very important fact and consideration that we took into account as we went through this decision-making process, was we looked at what's happening with inpatient services in general across the country. And so how, when you think about ultimately where you're going to invest your time and resources and dollars, do you want to invest that in a business or a part of the business that's growing and vibrant and helping people going forward? And you may not want to spend as much of your resources potentially in a part of the business that's declining. So for example, if you were Sony, back in the days when the compact disc was invented, you probably weren't going to spend a whole lot more money building factories that made cassette tapes. You were going to really focus on the future. And so that was a little bit of some of the work that we needed to do and think about, where is healthcare going forward? Now, certainly we don't have any crystal ball. Nobody does, but these are some of the trends that we're seeing. So nationally, what we're seeing is that, and this is the number of inpatient admissions across the country for a 5-year period from 2008 through 2012. And an inpatient admission is basically when you stay in the hospital overnight, typically more than one night, and so you've had something, a fairly serious either procedure or medical condition, et cetera. So looking across the country, here nationally, you'll see that for the last 5 years, all but 1 year in 2008, we saw negative trends. So decreasing numbers of people being admitted to a hospital for overnight stays. That trend is actually even more pronounced here in the local Cleveland market. So the next set of bars there is the 5-year trend for your 7-county service area. So Cuyahoga County and Lake County and Summit, et cetera. And looking at those, and you can see, some of those are kind of in the 2 to 3% range. So it's decreasing there. And over a 5-year period, admissions went down 5.5%, 5.6% to be exact. Next, you've got Cuyahoga County. It's even a little more pronounced in terms of the decrease, 9% in that same 5-year period. And lastly, looking at just what we would call the primary service area around Lakewood Hospital, which is 4 zip codes, 44107, and 3 other zip codes immediately adjacent to that, where you pull the majority of your patient population from, that market has decreased 10% in the last 5 years. And so it certainly is consistent with the trends that we're seeing everywhere. Nobody's safe from this perspective. Now, there are typically large common drivers for those things. One is medical technology, so changes in technology. What took 5 or 10 years ago, some sort of surgery took maybe a 3-night stay, now can be done either in 1 night or maybe even in an outpatient basis. So there's a lot of those kinds of changes going on. Secondly, we're seeing better management of medical conditions and health prevention in general. So doctors and their patients are getting more educated about doing the right things to keep people from getting to the point that they're so seriously ill that they need to be hospitalized. So people are getting smarter about their diabetes, for example, and taking care of that ahead of time so they don't end up in the hospital because something has gone wrong. And physicians even have thought about, even if somebody gets to the emergency room, potentially has some serious acute condition with their blood sugar, can spend an extra hour or two with them in the emergency room and get them stabilized and prevent that needing to be admitted. So a lot of changes like that are happening. And then lastly, a lot of employers around the country are making benefit plan changes. So people's insurance is getting more expensive. They pay more out of pocket, especially times when they have to be hospitalized. So people, unfortunately, sometimes are making economic decisions about when they get those hospitalizations and when they don't. So those are some of the examples of drivers we're seeing. Now, what you can tell here that's interesting, though, is that your immediate service area, both here in the county as well as here in Lakewood specifically, are kind of worse than than even some of the national trends. And we didn't explore trying to sort of parse out why that was, but most likely that has to do with the shift in the demographics of the Lakewood population. You have some younger people moving into the community, which is great news for a whole lot of reasons, but they tend to go to the hospital less than other folks do. It does sometimes have to do with socioeconomic status as well. So there's some other things going on there too. The one thing that I wanted to point out, this is sort of drilling into the detail a little bit around this same trend, but just to put a point on it so that people understand, because we certainly are very concerned about the older populations as well, and making sure that when we take into account community health needs here in Lakewood, we've thought about the older populations as well. And what we see here, based on this very recent study that was just released, the Chicago market on 8.5 million people, across that they looked at inpatient admissions by age group. And they're even seeing 8 and 9% increases in the over 65 and the over 75 population. So it's not just young people that are staying less time in the hospital. Our older generations are taking better care of themselves too and doing well there. So great. So what's going on then is, the stories that you see. And I wanted to spend a minute talking about one other example, because it has some very similar themes to Lakewood. So we've highlighted here the story about Quincy Medical Center, which is a hospital just south of Boston. It's in a south suburb of Boston. It's about 93,000 people, so it's a little bigger than Lakewood, but it's got fairly similar demographics and socioeconomic characteristics, and it's surrounded by a market that's incredibly competitive when it comes to the hospital business. So you've got, Massachusetts General and big academic medical centers there, and you've got some very successful community hospitals as well. So back in 2011, they were in bankruptcy, and Steward Healthcare, a for-profit hospital company, came along and they bought Quincy Medical Center. And they bought the hospital. They have 10 other hospitals, so it wasn't just a little fly-by-night operation. It was a reputable for-profit company, and they bought Quincy Medical Center and they plowed $100 million into that hospital. So they bought new equipment and upgraded the facilities and did all those things, and was a 196-bed hospital, and unfortunately they still couldn't save it. And so in early November of this past November of 2014, they made an announcement that they were going to close down the hospital, and they shut it down December 26th. So they gave about 5 weeks notice, and unfortunately they did end up, at the end of the day, they obviously had, unfortunately, a lot of community meetings that looked an awful lot like this one. In that community, and so they did reach an agreement that they'd keep the emergency department open for a couple more years. But I think it's just important to look at this and say, sometimes even with the best of intentions and a really deep pocket, you spend $100 million, and these forces are to be reckoned with in the healthcare business. So couldn't overcome some of that competition and things. So just felt like that might be an example for us to potentially take learnings from and think about. And obviously there are a lot of examples closer to home that you all know probably a lot more about, in terms of St. Luke's and some of those other hospitals. So where that comes down to, and we looked at this last time, so for the half or so of you that were there at the Beck Center, you've seen this one before, but basically when we boil that down to what's been happening at Lakewood hospitals, we talked about the market, the national and the regional trends, and even the local market in total, and then the impact that that's had on Lakewood Hospital. You can see that, even for the four-year period between, 2008 to 2012, we saw almost a 24% drop in the number of admissions at Lakewood. And the last 2 years, we've lost another almost 10%, another 9.8%. So Lakewood is definitely feeling the brunt of those forces of change, the changing needs of the community. You've heard a lot last time, a couple weeks ago, about the shift in usage of the hospital for outpatient services, et cetera. And so we're going to talk about that a little bit as well. So just sort of as a piece of information here, we looked at the the various types of visits and encounters and services that are provided at the hospital, both in 2013 and 2014, by and to and for Lakewood residents. So these are for people who live in 44107 zip code area. This is the number of, on the left-hand side, the inpatient admissions. So in 2013, there were 2,867 admissions. Now that's not people, that's the number of times people came to the hospital. There actually were about 2,000 people, but sometimes people come more than once. So about 2,900, just under 2,900, and then 2,700 this past year. Roughly 32% of all of the admissions in the hospital come from Lakewood residents specifically. And then on the outpatient side, you can see that basically pretty similar trends. About 30% of the hospital's business is coming from folks right in Lakewood. So we really, we tried to take into account how much, how many people from Lakewood are using the hospital, for what kinds of services, and that type of information. Now, compared, just as a point of comparison, if you go and you look at this data, this inpatient admission data for back in 2007, so 6 or 7 years ago, that number was 36%. So, or actually 36.6, it was close to 37%. So what's been happening over time is that fewer and fewer percentage of Lakewood's business right now is coming from people who live in Lakewood. So that actually kind of tells you a couple of different things. Tells us. One thing it tells us is that potentially people in Lakewood are beginning to go elsewhere for their care. The other thing it tells us, though, is that there are a greater number of people coming from somewhere else to come to Lakewood Hospital. And so we actually looked at that in a map. And if you look at first this map up here from 2007, this is the map of what we would call the primary and secondary service area of the hospital. So essentially what that means is we look at a map of all the zip codes that account for roughly 80% of the hospital's business. So the total hospital, where did those people come from? Where did they live? And back in 2007, you can see it's clustered pretty traditionally, a very classic pattern, if you will, in terms of the natural catchment area for the hospital. So some people come because they go to the emergency room and then they get admitted. It's the closest place, and so it makes a lot of sense that people would, come to the hospital that's close to them. Other people come because their doctors refer them to that hospital, etc. But what you can see is that by 2012, we had a very unnatural pattern forming in terms of the catchment area. And so what this is basically the impact that most likely the Cleveland Clinic physicians had when they made the change to involve some of those Lorain County physicians admitting at Lakewood. So you've got some of your specialty programs here, like orthopedics and the neurosciences programs, who are pulling from out in Lorain County. Now, we're going to talk about this later, but what's going to happen, obviously, is one of the things we had to take into account is that at some point there's going to be a Cleveland Clinic hospital out in Lorain County. And so some of these people, probably a lot of these people, aren't going to come to Lakewood anymore. They're going to go closer to home, because if it was you, you'd want to go closer to home too, probably. So, so that's an important piece of information to sort of understand about the impact of how people are sort of moving and going back and forth between service areas in the past, the way they used to do it, the way that they're going to do it going forward. So if we at some point go back to looking more like our what we would expect a normal sort of hospital catchment area or service area to look like, we're going to be kind of going after a smaller population. So that was what we had to really think about as we were evaluating the future of the hospital. Okay. So now what we're going to talk about is, where do we currently stand? What happens if we play this scenario out? And we keep kind of going the way we're going, and we make these projections, and we'll talk about that from a financial perspective in a minute. But I think one thing that's sort of important to understand as you go into that thinking is to make sure you understand what is each player's role in this process? And what are their responsibilities well, risks, essentially, in terms of financial risk? So the first player in this party is the city. And so the city basically is the owner of the property. So they're like your landlord. So if you rent an apartment, this will probably make sense to you. So this is, so they're the landlord. They still own the building, but they've contracted with somebody to use it and run it for them. And so they're the landlord. They approve, in terms of their responsibilities, they approve any major changes to the scope of the required services at the hospital, etc. That's their primary responsibility. Now, the creation of the Lakewood Hospital Association, originally back in 1985, as the mayor said earlier, basically got the city off the hook for the financial risk of that hospital. So I think the community recognized, even back in the 80s, wisely probably, that the healthcare business was a tough business to be in, and that it probably didn't make sense for the city government to be running that business. That somebody who's, that's their profession and they're professionally oriented to that should kind of be doing that business. And so that was what the city gave up so they got off the hook of, really footing the bill for losses and risks and borrowing money and bond issues and all that sort of thing. And what their responsibility was then is to just make sure that the person or the entity that they sort of put in charge of that was holding up their end of the deal, basically. Okay, so then you've got the Lakewood Hospital Association. So they're the renter, they're the tenant, essentially. So they have the responsibility to operate the hospital. Their responsibility is to use the assets, those assets that they're leasing from the city, to run the business. Their balance sheet, or their bank account, if you will, basically is what is used to pay the bills and fund the investments in the hospital and buy new equipment, and that's all their money, which is it's a public entity. It's your money. It's the community's money. So basically, they pay the lease payments to the city, and their responsibility, if the lease ends, is to return the assets to the city. And so they're the ones currently that bear the financial risk for what goes on at the hospital. So if they lose money, it comes out of that bank account, okay? And then lastly, you've got the clinic. So the Lakewood Hospital Association then turned around when this lease was originally signed when the agreement was signed in 1996, and delegated that part of their responsibility to kind of be the on-site manager. So it's not a perfect analogy, but the way I look at it is they're kind of the super, So they're keeping things running, they're fixing stuff when it breaks, they're running the day-to-day operations, making sure the tenants have what they need, et cetera, et cetera. So they run day-to-day operations. They employ the staff, they handle managed care contracting, they bill and collect for the money, on behalf of the association, et cetera. And for the most part, other than a few very minor exceptions, they don't bear the financial risk. So the money is the community's money, and it runs through Lakewood Hospital Association. And I kind of spent some time making a big point about that because obviously that's going to come into play a little bit later here. Okay, so what do we see? So we saw this chart last time. Now we actually have updated, for those of you who are really good with numbers, we've updated the last couple of numbers here. The 2014 estimated, they're not quite audited financials yet, but they're pretty close to being finished. So we've updated that, and it's actually a little bit better, I think, than the number we had originally a couple weeks ago. And then we've looked at the 2015 budget as well. But basically what you can see is the bottom line here is the hospital, from an operating income perspective, Lakewood Hospital Association has lost money. Sometimes a lot of money, and sometimes just about broken even throughout the course of the years, over the last 7 or 8 years. So that's the context. So the board in 2012 is kind of looking at this picture and saying, this isn't looking so good. We better think about the future, and what should we do about that? So we took that subsidium. Our responsibility was then to go forward and say, well, what happens if we continue to kind of run that story out? What will happen? Can we make it? Can we make it to 2026? And so we looked at the current trajectory of the volumes of the business that's coming into the hospital, and we looked at the impact of a new hospital opening, and we said to ourselves, you know, this does not bode well for Lakewood Hospital. So we're gonna see a pretty significant drop in volumes, and we can cut a certain amount, but then we're gonna have some fixed costs that we've gotta worry about. And so where we end up is that year over year, we start to really lose significant amounts of money. And by early 2018, there's no money left on the balance sheet. So right now, Lakewood Hospital Association has a bank account, and some of it's in cash and some of it's in investments and sort of things like that. But overall, they have a bank account that's got about $51 million in it. So the question was, for us, how long can we make that $51 million last? And if we don't think we can make it last past 2018, what should we do? Should we act now? Should we wait until then? Or, you know, what should we do about that? So that's where, from our perspective as the advisor to the board, we felt like this is a pretty serious situation now. We need to think about where we're gonna go from here, because what we want to make sure is that if we do want to pivot to some sort of different set of services here in Lakewood, that we're doing it while we've got $51 million in the bank, not when we have very little left to do something with. So right now you've got choices and flexibility. So then what we looked at is, so in addition to this problem, we've got sort of an operating income problem, and we've got some potential losses coming our way. We're also looking at the fact that if we want to keep the hospital going as a hospital for the next 20 to 30 years, it really realistically needs about $100 million worth of new investments. It needs to be upgraded. As you all know, it's been here a really long time. And so it needs enhancements to the physical plant itself. It needs, hospitals are expensive. They need new equipment and new upgrades, and rooms have to be refurbished, et cetera. And so the estimate was that would cost about $100 million. And so we looked at that balance sheet and we said, well, now, we've got 50. So, what does that look like? Is this the place we want to spend $100 million of our community's money serving your needs? And so just to kind of put it in a little bit of perspective, we did a little math. So that's basically for every man, woman, and child in Lakewood, roughly 54,000 people, that's $1,850. Okay, so that seems not outrageous, but it's a lot of money. For every one of the 1,980 people from Lakewood that stayed the night at Lakewood Hospital last year, that comes out to $50,000. So for roughly 2,000 of your neighbors to be in the hospital, is it worth spending 50 grand a person of your community's money to keep that hospital open, or do you think about some other direction? This is the kind of question we had to sort of wrestle with. And then we've got, $50 million in our account, and so we'd have to figure out, well, where's that other $50 million going to come from, if that's what it's going to be? And so again, I think this was the question of the day. Is this the highest and best use of our investment, or should we think about what our alternatives are? So then we wanted to just look at, so what if we do keep the hospital open? I mean, I think that absolutely would be everybody's preference at the end of the day. And so, right now, as I mentioned, we've got about $50 million in the bank. The city gets about $2 million a year in revenue between payroll taxes and the lease payments from the association. We got a hospital probably roughly a third occupied at any given point in time. We've got 1,100 employees to worry about. I think that might be a typo. It's 1018. It's 1018. Sorry, Shannon. All right, so I flipped my numbers there. 1,018 employees to think about. And we have services that are inpatients, outpatients, emergency services, and physician services. And so then the question is, all right, now let's look into the future, crystal ball time. and think about, by 2018, then what, where are we? So the potential, and obviously we won't know for sure, but the high likelihood potential is that if we run this scenario out, knowing what we know now in terms of the facts, we're at the point where we have nothing on the balance sheet. So the hospital has to close, the city loses the income, keep some assets, some of the same ones we've talked about, the medical office building and some of those things. The hospital sits empty because you don't have any money to not even knock it down. And I mean, I know probably a bunch of you know the story about Deaconess downtown. It's sat for 10 years empty. And that's not what we would want for the center of our city. So I think that's, something to think about. And we end up with sort of no employees to go forward, and and probably some physicians stay in their current locations, but a lot of physicians would probably move because they need to be somewhere where there's really a draw of bringing people in to the community and bringing patients. And so that's gloom and doom. That's the scenario of what it could look like if we play out the status quo. But then the alternative, just to kind of compare, is what we're proposing. And so what we're saying here is basically let's do something while we have a lot of money in the bank still, and let's make sure we keep a lot of that money for the community, a little bit above $32 million, 32.4. And the city definitely takes a revenue hit in the short term. They get some cash and some assets to offset that, and the mayor's talked a lot about what's going to need to happen in order to try to replace some of that revenue. You have a new outpatient campus, and you've potentially got some additional land to develop. You keep some employees in your community. Others, hopefully most of the others, get to relocate and keep their job. And you really keep a fair amount of the same types of services except for the beds. So that's the big difference, obviously, and it's a big building. Now, we've seen, in our experience as healthcare consultants across the country and around the country, we've seen a lot of hospitals close. What's unique, I think, about Lakewood, and what's unique about this situation is that top box. The money you get to keep in the community to invest in that health and wellness foundation, in the needs of the community. So I know some people have asked questions even about, well, the clinic, they're going to do their thing. You have your own money, essentially, to make decisions about and do what you want with it. So to me, as we were advising the Hospital Association board, we really kind of looked at that as an insurance policy for you all, to be able to think about how do we control our destiny and what do we do with that money and how are we going to invest it? We're not going to let someone else decide for us. So that's the potential alternative. And so then really just to take a step back, that's a lot about what could happen. So that was a lot of the context for the options that we considered. So I'm going to kind of work backwards and talk some about the options that we looked at. So way back at the beginning of this process, a year and a half ago, when we first worked with the trustees and the board, we really wanted to think about what is the full landscape of potential options to do with the hospital, knowing that our strong preference would be to keep it as a hospital. So the first thing we did is we came up with 10 options. I'm going to talk about those in a minute, but we put them through this screening process. Essentially, we said, does it fit with what we see in the market? Just kind of overall macro trends. Does it go align with trends, or does it sort of fly in the face of trends? So are we swimming upstream against the current like a salmon, or are we, sort of going with the prevailing winds and the prevailing trends? And does it, in the course of that, meet the needs of the community? So we had a lot of information about the health needs of the community, the challenges, et cetera, and we took that into account. The next was the competitive landscape. So for each option, is it reasonable to assume that we could be, as Lakewood Hospital, pretty successful at that? Who are we up against? How competitive a space is that? Do we think we could win? Next was, do we have the medical staff and the personnel, both the physicians and the non-physician clinicians, to deliver on that type of service. So if we're thinking about, let's say we want to be a rehab hospital instead of a general acute care hospital, do we have the right kind of physicians and providers in the community to be a great rehab hospital? So we took that into account. And then lastly, we thought about the readiness of the facility itself. So could we just flip it and turn it right into a rehab hospital, for example? Or would we have had to make some investment in refurbishing or sort of refitting the facility? And if we had to do that, how big is that bread box, essentially? How big do we think that would possibly be? So we took those into account, and we used that to screen these 10 options. And they fell in kind of 4 buckets. So there were 3 of them that looked a lot like the current, a lot like the status quo. And so we called it, modified status quo. But that was basically either, and number 3 was the closest to what you have now. So number 3, right now you have basically a general acute care hospital with some centers of excellence. So you've done that since 2010, you've had those centers of excellence in place. And so that's pretty much the status quo. Number 1 is pretty close to that, but it's basically right-size the hospital. Well, maybe it shouldn't be 233 beds. Maybe it should be 80 or 100. What's that right number look like? And then we also actually explored the idea of, well, it could be a hospital, but maybe it would be a lower acuity hospital, which means less complicated stuff. So you do deliveries and, very simple, diabetes care type stuff, maybe focused on chronic conditions, but not a lot of high-end surgeries and fancy stuff. And so we'll talk about that one. There were a couple challenges with that, but we thought that might be a better fit with the needs of the community, so we looked at that one. Then we had this whole bucket focused around, well, what if we really kind of shift our focus to being primarily focused on outpatient care instead of inpatient care? And we had a flavor of that, well, maybe we could keep a few beds at least, and so we kind of looked at that. Then we looked at 4 flavors of single specialty hospital. So could we change to just be orthopedics only? Could we change to be focused on inpatient rehab only? Behavioral health and psychiatric care. And lastly, LTAC, which is long-term acute care, or basically folks that stay longer than 10 or 20 days. Typically, this is ventilator patients and folks that have to have a high level of care, but for a long period of time, and or skilled nursing care. So, could we kind of be a long-term care hospital instead of just a short stay hospital? And lastly, just in the spirit of being complete, not that we really wanted to really entertain this as an option, but just to be complete, we thought about, what would it look like to literally just say, what, Lakewood, we don't want healthcare services in town anymore. There's plenty of them other places, and that's not for us anymore. We want to get out of the business. So we looked at all those 10 options, and we screened through them one by one. And so we're going to go, because this is going to hurt your eyes in just a second. It's very colorful. So we looked at those critical success factors that we talked about, those 4 factors, the market trends, et cetera. And then what we did as Subsidium is we made an initial recommendation as we evaluated each option. And then ultimately we made that recommendation to a subcommittee of the board, and they made a more formal recommendation to the board. And so we'll just kind of walk through these one by one. So basically first we looked at right-sizing the hospital. So shrink it down a little bit. And we basically, against each of those 4 things, and there's a legend here, so U is unfavorable, so red was the trend or the factor we're taking into account really doesn't support that as a good option. Neutral, so it could potentially, little question, and then favorable. So was this trend that we were looking at favorable toward this particular option? So in this case, for example, we said as a stay in an inpatient hospital, maybe be smaller. We looked at the fact that there was the overbedding situation in the market, inpatient trends decreasing, outpatient trends going up, et cetera. Just the trends in the hospital itself. And we said, well, geez, that looks pretty unfavorable from sort of a market trend perspective. It doesn't really fit. You're kind of doing the salmon thing upstream. And then we looked at competitive situation. Well, it's an incredibly competitive market. You basically have 2 big systems here in Cleveland just fighting it out. So that didn't seem like that was an unfavorable thing from a competitive landscape perspective. We looked at medical staff and personnel and said, well, you've got some risk. So if what we find out is that our current partner or our current lessor, lessee, I guess, the clinic didn't want to be in the hospital business here, then they were going to pull some of their physicians out, and so that wasn't necessarily favorable from that perspective. And from the facility perspective, we were back to we need $100 million, and that's too expensive. So that was unfavorable. We looked at the next one, this low acuity chronic care focused hospital. We liked this one from the perspective of fitting with the needs of the community. There are a lot of folks here that have various chronic conditions. We thought that would be helpful. But so you can see kind of we went neutral and looked at it and said, well, maybe this could work. Let's play this one out. What we found though is something that's pretty technical from a reimbursement perspective, although I think I heard Dr. Gilroy talk about this earlier, that the way Medicare reimburses, you typically make a lot of money on surgical types of admissions, and you lose money on medical type admissions. So if you go with, and they assume that a typical hospital will have sort of a mix of those, a market basket, and that you can kind of break even on that. If you go all one kind, and it's the kind that's unprofitable, then that doesn't work so well. So we literally did national database searches and looked all over for an example of a hospital anywhere in the United States that had made this work, and we could not find one. So we ended up ultimately at the end of the day recommending that we don't evaluate that further because we just didn't think the economics, the way the market is currently reimbursed, would work for that. So next we looked at the status quo, hospital centered with centers of excellence, some of the same trends we've talked about earlier. So we eliminated that one. And I think we spent a lot of time on that one, so I can certainly go back to that in questions if anybody has any further questions. So we looked at a family health campus, both no inpatient beds and with inpatient beds. And so with no inpatient beds, we felt like, well, it's consistent with trends. So outpatient services are on the rise, so that kind of makes some sense. From a competitive landscape perspective, there isn't a facility like that here in Lakewood today. So we felt like, well, that's pretty good. And these tend to be the kinds of services people stay pretty local for. So that was a plus in that column. From a medical staff perspective, you've got a lot of primary care physicians here in Lakewood, which is great news. Both from the Cleveland Clinic as well as independent community physicians. You've got a lot of primary care. So that was a vote for that one. And from a facility readiness perspective, it was favorable only to the extent that it would cost a lot less to build that kind of facility, $30 to $40 million, versus $100 million it would cost to build a hospital, or rebuild a hospital, fix the hospital. So that was why it got a favorable. It's not that $30 million is anything to sneeze at either, but that was why it was relatively more favorable. So same with the next one, the hybrid idea, which was to have a family health campus but have a few beds. Maybe those would be overnight beds or some observation beds, etc. We felt like that needed some additional evaluation because while the market trend still from a beds perspective was the unfavorable part, we still from a competitive landscape, there weren't a lot of models out there like that. We thought that would look good. And from the facility readiness, from a neutral perspective, was just that would cost some extra money to build those beds in there. Okay? So then we looked at all the specialty hospitals. And the bottom line on orthopedics is it's extremely competitive. It's a very high profit business, so a lot of hospitals choose to specialize in that and go after that, so a lot of competition there. You'd have to pull from a huge service area in order to really be able to have enough volume to keep a well-sized hospital running for that perspective. So you had some of those issues. Now, on the positive side, you had good supply of orthopedists here in town. So you got, so that was a plus, I think, on the physician side of that equation. But ultimately, we decided because of some of the economics and the competition that that was not the way to go. All right, so acute rehab. So inpatient rehab was definitely of interest as well. Obviously, at the time we were looking at this, so Lakewood has a very large, had a very large rehab presence at that point in time. So we're thinking about that from sort of a facility readiness perspective. That was a good thing. We got the medical staff in place. Some good things. Now, from a competitive perspective, that unit's actually already managed by this company called Grace. And there are 2 or 3 other pretty large, significant rehab hospital companies here in the Cleveland market. So it's a very competitive market. You'd have to rely on referrals from other hospitals. It sort of takes a little bit of the control out of your hand in terms of where your patients are coming from. So that was a concern from a competitive landscape perspective. And so ultimately we decided that a standalone rehab hospital might not be the way to go, but maybe if we were gonna go down the road of a family health campus that had beds in it, it might make sense if they were rehab beds. It ended up as kind of this hybrid option for a while that we evaluated in the next phase of the process. So then we looked at behavioral health psychiatric hospital. And so that fit from market trends and competitive landscape perspective. So the behavioral health business from an inpatient perspective tends to go in cycles. So sometimes it's really profitable for a while because the government pays pretty decent on it, and then there go for years where it's unprofitable again, and so it's a bit of a risky business from that perspective, but we're in a high cycle right now. So there's a lot of growth in behavioral health, there's a humongous need for it, and there's not that much competition. There's a lot of unmet need and unmet demand, which is terrific. And so, we kind of went down that road. Now, you would have had to make some serious investments in the physical structure of the facility because you've got to have some security measures and things like that in place. But ultimately, we decided that while that met a little part of the community needs here in Lakewood, it didn't really sort of generally help everybody. And so we were looking to try to, try to maximize the amount of value we could get from this investment to help the most people in Lakewood. So we eliminated it for that reason. Then we looked at long-term care and basically said, well, it's really competitive. There's already a lot out there on that. We've obviously got a lot of skilled nursing facilities here in town already. Good market trends, but still would have had to do some things on the readiness, so we eliminated that one. And then lastly, we talked about transitioning out and just really felt like that, that's not meeting the health needs of the community. That's not really an option that we wanted to explore further. So that's where we landed in terms of those discussions. Now, for those of you who know, we'll post all these slides after the fact, so you'll be able to see them on the website. There's a detailed, there's a slide for every single one of these, and I kind of just gave you the highlights verbally, but those are there as well. So I'm going to pause there and take a breath, and let the mayor carry us forward.
Thanks, Lisa.
Thank you.
Breathe deeply, in, out. So folks, our goal tonight was to give you an overview of basically the trajectory where we are, doing nothing, and the options we considered, and ultimately the recommendation that's before the community as we speak. So now we'd like to open the mics up. Remember, this is being recorded by Cox Cable, Matt in the back, and we, in order to capture your questions and or comments, we need you at the mics. So if you'd be so kind to line up as we did on the 28th. We're going to try, and I'm going to do a pretty good job of policing this time because we had a lot of questions. 3 minutes, hopefully no big speeches, but we'll try and address the questions and concerns you have. So anybody want to start? I see someone here. You ready to go?
Hello, my name is Lee, and I had a question and a comment.
Great.
There was a hospital in the 1920s in Bay Village. They closed 50s or 60s. After it closed, they turned it into apartments and condos. The other question, real quick, is with the new diagrams you're showing, are you going to show a visual of what it could look like 3D of what the hospital could be, so you get an idea?
That's the question. Do you have a comment as well?
That was it.
All righty. Well, actually, I remember getting stitches. I still have the scar in that hospital in Bay Village. And it is, what's the name of that? Castle Mara, right. So I presume the question is, could the existing hospital structure be converted to similar housing options? And the answer is, we haven't gotten to the question of what happens on the 4 acres that are left. It assumes right now that there'll be a demolition of the current and it'll be a green field with redevelopment. And that redevelopment conceptually has about really 4 options or some combination. And there's a 5th, and it's not going to be the 5th. It's not going to be industrial. I think it doesn't fit in that community for sure. But it could be residential, it could be commercial office, or it could be retail. Or some combination of those 3 would be the options that would exist. I guess there's 4 options. Industrial would be the 4th. So there remains to be seen, and we're new to this. This proposal came to be on January 14th, about 9 p.m., and we're beginning to engage in. The big question is: does this the path forward? And if so, what happens on the other 4 acres and other pieces and parts? We'll have plenty of community discussions when we get to that point. So the answer is undecided. I think all the issues are before us, but. Currently, it's important to know that the proposal requires the Cleveland Clinic to pay the demolition costs of the current hospital. Those are estimated in the range of somewhere around $12 million or more dollars. So if at some point, that if we don't demolish the hospital and we choose to later, we lose that partnership option. That's a factor to be considered. But hopefully that answers your question. No decisions yet. Okay, we'll go over here.
Yes. I remember back in the 80s when you tried to sell the hospital, okay? And somebody sued for $26 million and won it, okay? That was back in the 80s, mid-80s.
Yeah, I'm not familiar with that. Anybody familiar with that? We've got some folks who were here in the mid-90s, but I'm not sure about the mid-80s.
Oh, well, but then what I'd like to see done with the hospital is don't tear it down, leave it up, and just make a hospice out of it. There's no reason why somebody should die and have to go to a hospice out of the city. I mean, we live in this city, we die in this city, we're born in this city. I don't see why it has to go anyplace.
Would the hospice care be likened to the rehab, or how would that, of those
No.
10 options?
Hospice is dying.
Yeah.
Yeah.
All right. Well, I guess it's, we accept that as a comment.
Yes.
All right. Thank you. Over
Okay.
here. Thank you.
Yeah. Yes, Mayor. I understand your case about you're losing money and you're not going to be able to keep the hospital open because of what the clinic's done. What I'm not clear of is you're talking about an outpatient facility in the community with perhaps maybe a quarter of the employees that you had before. What's not clear to me, who would be running that facility? Who has the financial risk? Is that really even, is there a possibility that's a plan that may not even happen? I'm not hearing that discussed. Is it going to be a Cleveland Clinic facility?
Yes, it would be a Cleveland Clinic facility. Cleveland Clinic would buy the land, 2.5 acres, fair market value. They would put up at their expense a 62,000 square foot family health center. They have several of these throughout the region. Roughly $34 million. Would include a freestanding emergency department. It would be their facility to run it, their facility to take the investment risk and the performance risk. So, and on March 10th, we're going to be spending a lot of time here talking about what happens in that facility. That's important. We haven't really spent much time on that subject yet. How does that facility address healthcare needs in a community like ours? It's an open question. Thank you. Over here, Mike.
Yeah. You did a nice job running down different scenarios. Maybe you could talk specifically, I've heard in, UH, Metro, other partners, having some preliminary discussions with them about taking up the clinics, basically replacing the clinic, and also some national for-profits and other type. I wonder if you could talk a little more detail than we've already heard about, some of them had a little bit of interest and then backed off. What were some reasons for that? Are there still, did you turn over enough stones? Is there possibly some other player out there, I think that's what people are looking for.
Sure.
So specific about who else was approached besides the clinic to partner with.
Yep,
If you can
sure
delve
thing.
into that.
Okay. So initially, we approached all the major systems here in the Cleveland area. So we stayed local first, and we approached all those systems, and we did get some initial interest from one other system besides the clinic. So we had some discussions with them, so I'll come back to that in a minute. The initial discussions we had with that party were really actually also focused on an outpatient facility. It wasn't initially focused on an inpatient facility. A few months into those discussions, they had thought, differently about their strategy, and so they actually did then propose at one point to to take over Lakewood Hospital, essentially, and keep it as an inpatient facility. Subsequent to that, so we had several meetings with them about that and got a better understanding of what they were proposing, and then they ultimately withdrew that proposal. So that was not, in the end, that wasn't an option for us to consider. In the meantime, sort of parallel or simultaneous to that, we did actually market the hospital also to national for-profit hospital companies. So we started with a big list, and we narrowed it down, and we basically narrowed it by looking for companies that had examples of either had hospitals near here. So, because they're going to want some sort of adjacency. Usually, you don't just buy kind of a standalone hospital by itself. So, so we looked for hospital companies, for-profit hospital companies that either had other hospitals in Ohio or nearby Indiana, Michigan, or they had other examples of hospitals they owned that were the only one in a metro market. That they had onesies basically. So we marketed to firms that met that criteria. And initially, based on what we sent out, was a very simple description. The first time we sent out a description that was blinded. So it didn't say it was Lakewood. It described the community and the situation, but it didn't say who it was yet. And then we said, okay, if you're interested, based on that fact set, then sign a non-disclosure agreement with us and we'll send you some more information. And so we went through that process. So out of the 7 companies that we approached, 4 of them signed those agreements and got this packet. So then we sent out some more detailed information about Lakewood, disclosed who it was. They looked at that, and all 4 then declined to propose at all. So that was that process. Okay.
Yeah. Question here?
I wanted to say that I work in healthcare. I've worked in healthcare for over 20 years, so I understand a little bit of this. And I don't necessarily disagree with some of the trends that you've cited, although I think some of this is a little slanted, to be quite frank with you. Okay.
Fair enough.
What's going on here, and you put your finger on it, it's competition, all right. But it's competition between the Cleveland Clinic Foundation and university hospitals. And Cleveland Clinic can't make this brand new hospital, which if we have these trends about declining admission rates, why is Cleveland Clinic building a brand new hospital in Lorain County? Because they don't have an influence out there. So of course they've got to build this. Well, how do they make that happen? They've got declining admission rates at all their other hospitals, Lutheran and Fairview, and all these other hospitals. So how do you make this work in Lorain County? Well, you make it work by you get rid of Lakewood Hospital, so that all of us then will be forced to have to feed into these other healthcare facilities. They don't have the population out there. The only way they can make that work is to try to get more patients fed into these other hospitals. And we're the odd man out. Now you can say you cited declining trends, but how much were the other hospitals upgraded? How much were the other hospitals promoted from a marketing standpoint? How much were the other Cleveland Clinic hospitals given other services, and things were stripped from us? So this is basically a fait accompli. Okay. This is all about business, folks. This is the corporatization of medicine that you're seeing firsthand here, and we are the odd men out. I found it very interesting that somehow it was a problem that Lakewood Hospital was drawing customers, patients from other communities, and that somehow is a problem. But yet if you close us, we're going to be forced to have to go out to other communities, and somehow that's okay.
You know, if I could address at least a part of what you said.
And if I can say one other thing, that it's pretty obvious this is going to happen. But I really think that I heard somewhere that to do this, you were going to have to sign a no-compete clause for the Cleveland Clinic to be exclusive here. I absolutely reject any no-compete clause that would disallow any other healthcare organization in the future from coming into this community.
The no-compete clause, it's important to know that the no-compete clause addressed the 6 acres of land. It does not address any other real estate in Lakewood. It's the 6 acres of land.
But that's where the hospital is now.
That's correct.
So somebody's going to build something else somewhere else to compete for healthcare?
That's what, those are the facts. I mean, it's, other entities can
So
be
that's a
here in Lakewood.
negotiation though, correct?
It is. It is a negotiation. That's correct.
But again,
But it applies just to that 6
Okay.
acres, not Lakewood.
But I'd like to end this by saying that, you have a duty to the citizens of to the city of Lakewood, and not to the marketing and business plans of the Cleveland Clinic Foundation. Okay?
You know, I'd like to ask some of the other trustees who are here, because I know that accusation has been made that we're not interested in the citizens of Lakewood. And I will tell you that's absolutely not true. We worked hard, first and foremost, to meet the needs of this community. And we worked hard to understand how they've changed and how you could build a healthcare system that's viable, that won't be gone in 5 years or 3 years like Quincy Hospital. That would be a serious error. We did not want to make that error. We have to do it right. We have one shot at it, and we took all those factors into consideration. I'd like to actually ask a trustee, anybody on the trustee side care to address that particular question? Did we or did we not sell out to the Cleveland Clinic and ignore the interests of the citizens of Lakewood? Becky Patton is a nurse and actually teaches at Case West Reserve. I'd like to give her the podium, if you would.
So here's what I would tell all of us. I live here in Lakewood too. I've lived here in Lakewood. I bought my first house in 1989. So I'm committed to the community and probably have some of the same interests that you have. But the reality of it is healthcare is changing. The previous speaker spoke to that. And we can spend the next 10 nights blaming ourselves and the situations that we're in. Does that get us anywhere? I think the process that we did was a good process. I think the data that presented shows that inpatient hospital beds are no longer a viable option. We can keep the building. It's an old building. It's going to cost us a lot of money. So we're going to run down the money. We need to think about what's the best option to create a healthy Lakewood. And this is a paradigm shift. And I think that our beginning discussions will allow us to get there. So we could blame the Cleveland Clinic. We probably need to blame UH equally because they all have played our citizens and the communities against each other. But it's not going to do us any good. So how do we move forward? That's where I guess I'd like us to focus on is how do we move forward?
Thanks, Becky. Let's see, which side are we on? Over here.
All right, my name is Dean Dilzell. I was just, let's make the assumption that the Cleveland Clinic is going to close down Lakewood Hospital. I think those of us that were here at the meeting last time and tonight both recognize that that's going to happen. But rather than selling the land to the Cleveland Clinic to put up a facility, why don't we make it competitive? The city build a facility with some of the funds that are available through the Lakewood Hospital Association and let the providers in the area compete for the customers that are in Lakewood. We don't all go to Cleveland Clinic for our health care. Some of us go to Metro, some of us go to university hospitals. Why not allow them to compete based on the services they're going to provide to prevent diseases Have them compete in Lakewood, really set a standard for healthcare, not follow along with what is being dictated to the community by the Cleveland Clinic.
Well, it's an interesting point, but I would say, who bears the financial risk? And I would say we would have to be very thoughtful about whether we want to bankrupt this community long-term on this bet.
It sounds like the community is going to go bankrupt regardless of the choices that were provided tonight.
Well, that's an opinion.
It's just a matter of
I don't
time.
share that opinion. I don't share that opinion. Mrs. Harkness?
Thank you. I'm Marguerite Harkness. I'm a CPA. First of all, I would like to ask that you please set up a blog online that all and any of us can contribute to and send in our comments and our suggestions so that you can get them through the month. Second, I have some ideas on how this might look. I like the idea of a healthcare facility rather than a sick fix facility because our whole healthcare system is a sick fix system. It is not a healthcare system. I could see this with a possible stepped model of care where you have, in this new building, you have a nurse on call with a CVS mini clinic, then you have an urgent care clinic, then you have a Lakewood ER with all the diagnostic equipment, including keeping the CAT scan, the MRI, keep the lab and the diagnostics, then have an attached hotel, like a Novotel. We only have one motel in Lakewood, and they know how to run overnight rooms. You could have one floor that goes through to the ER and diagnostics. For the real small, quick medical needs, the CVS nurse on call would be there for the little stuff, so we're not sitting in the ER for 8 hours to get a splinter out of a kid's finger. This could include flu shots, shingles vaccine, cough, cold, similar respiratory things, sick kids, cut fingers, checking surgical.
Does it work?
What?
Yep,
Oh.
okay, we're good.
And then the urgent care, and then the ER to handle the cardiac, stroke, multiple medical type issues, alcohol addiction emergencies, unknown medical conditions that need blood work, CAT, MRI, ultrasound, the other diagnostics, without having the ER to deal with the small stuff that gets in their way, and then maintain the labs, keep the women's center across Bell Avenue. And I would suggest that you contact Novotel, which is the budget line of the Hampton Inn Motel Group, because they know how to run an inexpensive overnight room motel that is nice and has all the amenities that are needed. And I think if you had a motel there, that would be a big help for Lakewood.
All right, and I trust you've got that electronically. Perhaps you could forward on in an email,
Yes.
mayor@lakewoodOH.net.
Say again, please.
Mayor, M-A-Y-O-R, @lakewoodOH.net. And actually, we have a wellness email.
That's where I send
You
it.
don't have that up?
I guess nobody read it.
Yeah, we did get one, actually. There.
Must have been mine.
Yeah. We did.
Thursday,
we did get
January
one.
29 at 10 a.m. Thank
Yeah.
you.
Okay.
Over here.
Hi, I'm Connie Pachorik. I've been in the schools for 20 years, moved here from Oregon, raised my family here, all my kids. It's been a family community from the day I got here. Houses and houses and houses of people with families. Yet some years ago, they decided to take away pediatrics and having children from our hospital. Now, you said our city is becoming a city with all these new young couples in it, and I know that because I see them in the schools. These young couples coming into our community are getting married and having babies, yet they have to go somewhere else to do that and to have their children taken care of. So I'm wondering, why was it never considered, or why were we never talked to about the fact that the OB department was removed and pediatrics are being removed? The hospitals that have those have now gotten all kinds of money to upgrade their hospitals. Why can we not have those back? And maybe that would help our finances and our families in Lakewood. If you could take your sick child to Lakewood Hospital or have your child at Lakewood Hospital, would that not up our number? You say only 33% of the people in Lakewood use our hospital. Well, because more people have young children and are having young children, and they can't go to Lakewood Hospital. So you made our numbers drop by removing those services. If you brought those services back, does that not make our numbers go up?
Actually, only about 4% of the citizens in Lakewood actually lie in a bed in Lakewood Hospital each year, 4%. A third of those who do lie in a bed are from Lakewood. And I would say come on March 10th, we will be exploring more carefully and thoroughly what services will be provided. Pediatrics is expected certainly to be on an outpatient basis, an important part of the service through the Family Health Center. So March 10th will be an opportunity to learn more about that. Yes, sir.
Hi, my name is Jared Denman. I'm a freelance journalist writing a piece for the Lakewood Observer. And I guess my first question, and correct me if I'm wrong, so $32 million is planned to go to the new wellness fund.
That's correct.
Okay, and then $75 million to the LHF or the LHA?
No, 34 million for the new facility.
Okay.
It's a physical place.
Right.
A fair market value for the land, yet to be determined what that market value is, 2.5 acres.
Right.
There's a significant cost of winding down a hospital and transitioning the hospital out, actually somewhere between 30 and 45 million is estimated there. And then $8.2 million gets, well, I'll tell you what, if you're a journalist, once you see me after, I'll make sure you get these numbers right.
No, I got a couple questions I just want to
okay.
ask. So we're talking in the millions, all right, and this is going to a private nonprofit. Is there any way that sunshine laws apply to where that money's going?
You mean the Wellness Foundation?
Right.
That's
and the
yet to be
LHA as
determined.
well.
That's yet to be determined. We have the governance how we govern that. We haven't addressed those questions yet.
Yeah, it's just a concern that maybe possibly the assets of a public asset are being transferred to private hands. So I just have one last question. What was the rationale for transferring services from Lakewood to Fairview? What was the rationale? What was the LHA's rationale for allowing that to happen? Given its mandate.
There were two primary categories in 2010 that were transferred. One was trauma care.
Right.
The county made a decision to rationalize trauma care in the county. You needed certain volumes of trauma to be a trauma center, level 2 or 1. Metro is our level 1, and you needed, and there's a couple other level 2s. Fairview Hospital is 1. In Lakewood's case, in 2010, we had about 1 trauma case a month, 12 a year. And in order to maintain trauma status, you need to have 24/7, 365 care for 12 cases a year. Cost about $1 million, if I recall correctly, and the economics of that didn't make sense, and the quality of care, if you're not doing it every day, didn't make sense. And so that was moved to Fairview, 12 cases a year. Pediatrics was the other one. I think it was less than 3 patients a night, less than 2? 1.5 patients a night on average for overnight care for a pediatric patient, a child. And the economics of maintaining capacity to do it safely and from a high quality standpoint for roughly less than 2 patients a year was common sense didn't say that should continue. So,
yeah, I think it's well known that trauma it can tend to be a loser, but what about cardiology, pulmonology, urology, things that got transferred over?
you know, in 2007, I've learned that cardiology or heart surgery was removed from Lakewood Hospital. And in 2007, Lakewood did about 50 heart surgeries a year. At that point in time, 2007, Fairview did 300. And so those diminishing volumes of heart surgery, also quality of care, consistency of practice, high skill level, didn't make sense. Those heart surgeries, 50, moved to Fairview. And in 2014, Fairview had 215 heart surgeries. And they're probably trending south as well. So the reality of it is, care like heart surgery is one of those where technology has dramatically affected. Do you do it at all? And if you do it, you better do a lot of it and be good at it, not only for the reasons of quality of care, but the skill of the surgeon and the economics of having a special process like that. So those kind of high specialty units are the ones that are going to be moving around. Dr. Cosgrove, about two weeks ago at a panel discussion that included Tom Zenti, CEO of University Hospitals, included Akram Boutros, CEO of Metro Hospital, and Dr. Cosgrove. Dr. Cosgrove said the future for heart surgery, if you were going in as a young doctor, he wouldn't recommend it. He said, you know, there's just, it's a dying breed, literally, I think was the pun. He said because the dynamics of who and when you do open heart surgery have changed so dramatically from 30 years ago. And that's a case in point of the Lakewood Hospital story. Pulmonology I can't speak to, but I know I did, I think Dr. Kilroy maybe.
We just got old.
Yeah.
I'm the youngest of the four.
Yeah. All right. So hopefully that answers your question.
Yeah, thank you.
Yeah. Thank you.
Anyway.
Yes. Back over here, Ed Graham.
Yes, what I'd like to know, you're a businessman, and you talk about the fair market value. What I want to know is how much cash money will the city of Lakewood receive from the sale of the hospital property? And I don't mean the Westlake building. I mean this property right here in the city of Lakewood. How much actual cash will the city derive from that sale?
Fair market value of 2.5 acres. Don't know what that number is yet. We haven't
Why
appraised it.
don't you know? I mean, this is
I've got a guess.
Important business transaction.
Yeah.
Who did the survey? I'm sorry, who did the appraisal of the property?
The,
We have not had an appraisal done
Yeah.
of the hospital property yet.
Why not? That you're talking about selling valuable property and you haven't even asked for the
Well, we're
value?
still having this conversation, and so we did not go forward in doing those types of things until, obviously, we have this dialogue with the community.
Well, you're putting the horse before the cart here. I mean, the cart before the horse, I should say. I would think if you're thinking about selling property, the first thing you'd want to know is how much is it worth?
Our primary concern was figuring out how to deliver an effective healthcare system that meets the needs of the citizens and is viable long-term. That was our objective. How the dollars fell out was a secondary objective. Healthcare delivery has to drive these decisions. Lakewood Hospital is not in the business of providing dollars to the city of Lakewood. Its primary mission is to deliver healthcare. And that's what we have to stay focused on here. And that's the changing marketplace. The trustees understood that full well. We have to make the economics work. But in the end, we're talking about building a healthcare system that's built to last, that makes sense. That's what we're focused on here.
What I got from reading the letter of intent, it boiled down to the city will give the hospital to the clinic. With all the circumlocutory talk they had about forming a new healthcare foundation and so on and transferring money around, the city gets nothing.
No, the city gets $8.2 million from the sale of
I
property.
told you I'm talking about the hospital
Well,
property,
that's all part of the
not the
hospital.
Westlake.
That's all part of the system.
Well, I want to know about the part of the system that is here in the city of Lakewood. We get nothing for that under that proposal in that letter of intent.
The city gets 4 acres of land for redevelopment.
From
Greenfield.
whom?
Well, it's not, there's a hospital on it. It's not, you can't, well, if you redevelop the existing structure was built for a specified purpose, that's a possibility. But ultimately, the new proposal does not require 6 acres of land to perform its mission. And that leaves other property available for redevelopment in the city of Lakewood.
And the city gives away a very valuable piece of property, a very valuable asset worth probably at least $65 million for nothing. They get nothing.
Tell you what, Ed, if you could find a buyer who's willing to pay $65 million for that real estate, boy, we'd be very interested.
I found a buyer, or you found a buyer that's willing to pay $0. I don't see where we'd lose out.
We found a buyer who's willing to invest $34 million on that land to deliver a healthcare system that makes sense long-term. That's what we're talking about here. Dr. Kilroy?
Hi, I'm Dr.
Wait a
Terry.
minute, I'm not done yet.
We agreed that we would try and focus on 3 minutes, Ed. We've gone over that.
We did not agree on that. You dictated that. We didn't agree to that.
I did, out of respect for others who want to ask questions.
And they certainly are welcome to ask questions. I don't see 22 people in line looking to ask questions at the moment.
Well, Dr. Kilroy, do you yield the 2 folks? Do you mind waiting for Ed to speak? Nope. All right, Ed.
Thank you. From what was just shown here, the city presently derives $2 million income from the hospital. Is that right?
About 1.8.
Okay.
1.9.
What is the city presently doing with that 1.8 million?
It funds the Lakewood Hospital Fund. We pay emergency medical technician folks out of that fund. We pay, actually, director pay. Finance director pay can probably be more accurate and specific to that fund. This is Jennifer Pay, finance director of the city of Lakewood.
Yes.
You may have to step up to this mic. That's not working.
Is that one working?
Yeah, there is money that comes
from the current lease payment that comes to the city goes to the Lakewood Hospital Fund. And that fund supports our EMTs that came over to the city in 1999, and also firefighters that do firefighter EMT. Also, our small part is our vital statistics as well. So the lease payments and then our transport fees fund the Lakewood Hospital Fund. And then we also get, obviously, withholding taxes from, income taxes from Lakewood Hospital employees.
So the 1.8 million is coming out of the general fund and being paid to the hospital right now? Is that what you saying?
No, that's not correct. Director Pay, you want to get that squared away?
Yeah, the lease payment from the clinic does not go to the general fund.
That's about $1 million a year.
The $1 million rent isn't actually paid to the city.
It's paid to the city.
It's paid to the city, but it's in a different fund. It doesn't fund police and the general operations of the city. It's very specific to healthcare, and how we can spend that money from the lease is specific to healthcare for the city, hence EMTs and paramedics.
So it helps pay for the fire department, portions of it,
Correct.
and so on?
Correct.
Okay. How are you going to replace that money if we don't get it?
Well, we've got to replace it. By getting ahead of this trend, you know, we're looking at a case of 2026 where we have nothing, and we want to avoid being in that position. And by acknowledging the adversity of the healthcare marketplace as it affects the finances of the city of Lakewood, by doing so boldly, which we're doing in this proposal, we have it's going to be a combination of other revenues through creating other job creation in the city of Lakewood. Those 4 acres of land become very important to us in terms of what happens there and their economic impact. We have Lakewood Center North is actually 2/3 empty. We have a huge opportunity to gain some traction there and need to work with its owner. We have some strategies employed to run fiber optic to increase the attraction of getting some tenants in that building. That's important to us. We have to continue to keep a belt tight and manage our costs effectively. We will use our current efforts of lean government, which have been very effective at gaining speed, lowering costs. Those are very important. We are hopeful that we can work hard to be one of 3 cities now in the county that have the lowest income tax rate of 1.5%. We hope to stay there. That's important to us. Everybody else is higher. All our neighbors are higher. And we don't see raising taxes as a necessary tool. We look to the $8.2 million as a potential buffer to give us time to get to a place to replace those. And we have our work cut out for us. But we're confident that we can apply strategies that are effectively to close that amount. And I would say since 2008, this government has closed pretty close to $8 million of lost revenue. So 1.5 is a big number, but we know we're up to that task. The was mentioned earlier about going to need to provide more transportation, primarily for old people, to get health care. Where is that money going to come from? Well, we're currently in that business today of providing transportation for senior citizens. We run buses, we run cab vouchers today, and most of those are, in fact, for medical destinations. So I think continuing to do that, anticipating maybe more volume, will allow us to get some predictability. So we're doing that today. So if you're 60 years old, which you and I are, Ed, you can call the city and we can arrange transportation somewhere within 8 miles to get you to a medical appointment. We can do that today.
But you're going to have to take people like to Fairview and out to Avon to get to the hospital. That's a long ride to get to Avon, since they're moving some of their services out there.
The services they would move to Avon are readily available in Fairview. And we're going to have disproportionately more services that we use on a regular basis as outpatients right here in Lakewood. The goal is to actually align service requirements for our citizens right here in Lakewood. The difference is those 2,000 citizens a year that lay in a bed, that live in our community, they likely wouldn't, well, they won't be here. They'll either be in Fairview or some other place. We're talking about 2,000 citizens a year. But on the other hand, we're talking about tens of thousands who get outpatient services and probably tens of thousands more who need even more outpatient services. That's the kind of healthcare system we have to build here. We have to address these issues of chronic care that I addressed earlier, that are the key drivers of poor health, and we don't do that by lying in a bed.
I'd like to know how much this service that we have going on tonight with the
Subsidium?
Subsidium, yeah.
It's
How much did
paid
that
for
cost?
by the Lakewood Hospital Association, no taxpayer dollars involved there. Ken Haber,
How much
can you
was
address
that?
that question?
About $500,000.
About $500,000.
$500,000.
Year and a half. Yeah. Yep.
Okay, I have a lot more questions, but I'll give other folks a chance.
Thank you.
Thank you.
Dr. Kilroy?
Yeah, I'm Dr. Terry Kilroy. I live at 15431 Edgewater Drive for 30 years, and my practice is based in Lakewood at 14701 Detroit Avenue. My questions are simpler. The first, I think, is actually a correction, Mr. Mayor. On page 4 of the letter of intent, it says LHA will bear all costs of terminating and winding down its patients and other operations and all costs of demolition to prepare the land for the construction of the FHC. So it's in the LHA's budget to demolish the hospital, according to this. And the question I have is...
I understand the question, but go ahead.
Yeah, the question I have is, what are the demolition costs and what are the closing costs that's going to go to LHA? Second question I have is later in that paragraph it says, upon LHA's dissolution of all LHA property of every nature and description, and any and all equipment and fixtures at Lakewood Hospital shall be monetized, paid over, or transferred to the clinic. So what's the value of the hard assets that we're giving to the clinic? Because frankly, the way I look at it is they're giving us $24 million into the LHA. We've got to demolish the hospital. We've got to prepare the land. We've got to do the closing costs like paying subsidium. And we're going to give them a certain value of that, and I don't know what that is.
Yeah, I don't think that's quite correct. Ken, can you address this? This is Ken Haber. Ken is as a volunteer, as trustee, he's done an enormous amount of work addressing the financial aspect.
It's page 4.
Yes. Good evening. The projections, and these are projections, to what you said is correct. The current balance sheet of the Lakewood Hospital Association, as it gets wound down, okay, there is, at the end of that wind down, 2 years from now, okay, it's going to take a lot of detailed management of that wind down, and that includes, to your first question, what's it going to cost? It's an estimate, roughly around anywhere from roughly $33 million is right now what the estimate, and that includes everything, including the demolition. It includes the potential severance and retentions for employees. Okay. It will also include the operating losses, the deficits that could and likely might happen over this period of time. After that is all done, okay, through this 2-year period, at the end of the day, there's estimated to be left, that residual, is $24 million. Now,
so you have 50 now, and you're getting 24.
No, let me finish. Well, let me finish, and then...
Is that right?
Let me finish my explanation first, and then I'll be happy to answer your follow-up question. So right now, 2 years from now, it's estimated there'll be $24 million left, monetized, various assets, cash, equipment maybe.
And we have 50 million now?
No, the 50 million is part of the balance sheet today. That's the investment. There's over $150 million of assets on the books right now, approximately, okay?
Okay.
So we're taking pieces parts.
Okay.
So, and including that 150 is the current assets of the Lakewood Hospital Foundation.
Okay.
Okay. So that's another part of those assets. So if you think of the balance sheet, 150 million roughly, you start to dispose of these things. The Lakewood Hospital Foundation is I call it, moves on its own. It has its ability to determine its future role in this community from a philanthropic perspective. As we wind this hospital down, it's going to take cash to do that. Again, at the end of that 2-year period, is estimated about $24 million. Okay. So the $24 million.
That's the leftover in LHA?
Yes. Okay. And that is what's going to be advanced ahead of time now to the community to form this new community-based health foundation that we referred to.
And, that includes the 24 mil the clinic's kicking in?
No. The
No.
24 million is coming off the balance sheet of the Lakewood Hospital Association.
Right, well, that's what I'm saying.
Yes.
That
So the
sounds-
clinic's not kicking in 24 million. What we're doing is we're prepaying that residual that we estimate could be 24 million in 2 years from now.
Okay.
But we negotiated the risk. We negotiated not taking on that risk and saying, if you think it's 24 million, then why don't we just agree, we'll take the 24 million up front now, and you take the risk. That 24 million could be 24, it could be 10, it could be any number of things. But right now, it's estimated to be 24. We, as the association, didn't feel that it was worth taking that risk and that unknown risk.
Okay, because what I understand is the next phrase basically says that if you blow through LHA's net asset, then the clinic picks up the rest.
And that's the point. So if, for example, the cost of demolition and the deficits of operating this over the next 2 years could be not 33, it could be 50 million. Okay? The 33 is the factor that goes into the calculation of that 24 million estimated at the end of the 2 years.
But
So
LHA
the 33
has to go
becomes
broke
50.
first.
Pardon?
The LHA has to go broke before the clinic picks up the rest? Is that what that says?
No. Think of it this way.
You're confusing
Okay.
me, yeah.
Well, okay, and it's very, without a graph, maybe.
Yeah.
So, again, 2 years from now, everything is wound down. Okay? What's left on that balance sheet? After paying off the demolition and all the other costs of going through this transformation, it's estimated to be $24 million.
Okay.
What we're saying, what we agreed to, what we negotiated, is that we don't want to take that risk and wait 2 years for that money. Let's agree, you, the Cleveland Clinic, take that risk, and we'll take the 24 million now,
Okay,
and
so
not wait.
And that's going to be in the final agreement?
Yes.
Okay.
Is that, hopefully that's a little
Yeah,
clearer?
if that's, because this agreement doesn't say that, but that one,
So,
you're
and
saying
the way
it's in the
that,
final
and
agreement,
that,
that's
and
a
the way that
different
was written is to ensure that Lakewood Hospital Association or the city isn't on the hook if the estimates are wrong with regards to the cost of the demolition and going through that.
Okay. Well, my next question is what are, maybe it's me, but I was at the closure of St. John's, okay? And when we sold off all the parts and pieces and equipment and stuff, that was $10 million, okay? Lakewood's got a lot more stuff. This is 25 years later. So this phrase that says all the LHA property of every nature and all equipment fixtures at Lakewood Hospital will be turned over to the clinic, how much is that worth?
Right now, that's estimated to be 24 million. That's at the end of the 2-year period, what is left, what is monetized, what that is referring to is that $24 million.
Okay, how did we arrive at that?
It's based on...
Who arrived at that?
That was the clinic's, as the management of the of theirs.
So we didn't get an outside, okay. The third thing is actually the same issue, which is both on the property the hospital's on and 850 Columbia. I talked to a real estate attorney, and I talked to a couple of bankers, and they told me in commercial stuff, usually you do 3 estimates, one from each side and one independent. And kind of, did we do that, and what were the 3 estimates?
There was one estimate provided, and that was a real estate opinion.
Okay.
Is that correct?
Yeah, and the last question is that what I'm really getting confused about is both Cosgrove at Lakewood and you, Mayor, said that the clinic is investing $120 million, and I can't see that.
I don't have them in front of me.
Maybe next time?
Yeah, we're going to pull it because we have a...
Yeah, maybe next time put up a...
We'll put up a slide.
Yeah, okay.
It includes the transition costs. Okay.
Yeah.
Don't go away. You may need it. Yes, hello. Nice to see you.
Hi. I just want to say I agree with the other guy that said that this is very trending the wrong way, because I've been in healthcare 30 years. But my biggest concern here is I live across the street from the hospital. And every time that they've expanded, we've had nothing but problems. We just had to fix all our sidewalks. The last time they expanded, our sidewalks cracked from all their demolition and everything over there. But then I have to pay to have them fixed. And when we contacted them and contacted the city, they said to us, too bad. So now here it is, years later, and the city comes and says, you got to fix them, $500 to fix new sidewalks. If this happens again, who's going to fix them the next time? And when you put the dumpsters out front on Marlowe Avenue in front of all our homes, When they empty them and bring them, are they going to do that at 2 o'clock in the morning like they did the last time and wake all of us up? And are they going to start construction at 5 o'clock in the morning like they do their snow removal at 5 o'clock where in the street by the meters where they don't need to do it at that 5 o'clock in the morning to wake us all up? I mean, it's a big inconvenience every time they've done construction over there.
I guess there's a series of questions there. I presume you live on the east side?
I live on Marlow, yes.
East side of Marlow?
Yes, right across from the ED.
Yeah, I think you and I have had conversations
We have.
when I was a ward councilman. And you know, those are specific questions. I will tell you, working through development and redevelopment in Lakewood is a hard conversation. We're about to build 4 new schools. There is going to be $100 million of school construction going on in Lakewood starting now. There's going to be another $10 million residential development at the old McKinley School site. We've got some traction finally on the Rockport site down the way. We have other investments that are being made. We're about to spend $3 million to repave Madison. We have 4 streets that are under construction with new water mains and resurfacing. We have an additional 10 streets that are in normal refurbishing. Working through these issues in Lakewood is not easy, and we work with citizens like you in every one of the cases to figure out how we can make it work. And I guarantee you, most folks would want us to have the streets plowed before they go to work, not afterwards. And we have to do that at 5 a.m. to get ready for that.
Well, I understand that, but we're not talking about it snowed tonight and there's 3 inches of snow. We're talking about it snowed last Wednesday. Saturday morning at 4:30, they were out cleaning in between the meters. The sidewalks were clear. This was in between the meters where they had piled all the snow. That's pretty unnecessary at 4:30 in the morning, 5 o'clock in the morning.
I'll have to match you up with the folks who complain about they have to hop over those piles of snow to pay the
Well,
meter.
then the Lakewood Hospital employees shouldn't be parking at the meters. They should park in their garage. Because Marlow Avenue, all those meters on Saturday and Sunday are Lakewood employees for that hospital. That nobody else can park there on the weekends.
Well, you and I will talk again, more specifically about your issues, but I will say we managed the best that we're able of complex construction in very tight construction sites in this town. And that's not going to change. It's all part of progress and renewal and investment, and we have to work together to figure out how to make sure this city remains vital and its infrastructure remains intact. And it's hard.
Well, and I understand that, but people tend to forget that the hospital sits between Marlow and Bell. When they do stuff on Bell, it's all commercial. But when they do things on Marlow, it's all residents, and everybody forgets about us.
Yeah.
You know?
And I know there's been issues we've dealt with through noise from air conditioning units, et cetera, that
Right.
we've made improvements on. But I appreciate your point, so we can do better. Mrs. Graham?
I'm going to preface this by thanking everybody that came here tonight. And Mayor Summers, I do want to say this. You're allowed to have all these projects going, the schools. We have never voted down a bond issue. We have always, the people of Lakewood have always supported everything. We built and renovated the library, and what's being done to us is unconscionable. Now, I'm going to ask some questions of the representative there. It said that they're getting $500,000 for their expertise. Is that correct?
That's correct.
Okay. In regards to the clinic, they own over 80 properties. Out of the 80 properties, how many did they sign leases with?
The Cleveland Clinic would have to answer that. I don't think we know the answer.
Oh, sure he does.
Dr. Jones, yeah, I mean, I guess 80 facilities in the region, the world, I guess.
No, I just feel, and I think the majority of us agree, I think Lakewood was the bad deal that they conjured up to have the 30-year lease, and now they still have 11 years, and, you know, this is the problem they've run into.
All right.
I want to talk about the hospital and the property itself. Now, I go way back, you might not know me, but I, over 12 years ago, came to the council meeting and wanted to know why the whole row of storefronts from Marlow on Detroit have sat empty. And we're not talking about a year here or 2 years, 11 years. Plus, upstairs they had rental properties, apartments. It has sat empty all these years. Nothing has been done. You had the Christian Life Center, the next building up. That's empty. That's sitting empty. This is owned by the hospital. This was money that was supposed to be coming into the hospital. But for 11 years, you've done nothing. And I heard from a very good source that, they went and inspected this and that it wasn't structurally sound. Well, fine, level the building. But no, our experts here, the Historical Society, said that this is an historical building. Well, take a look at it. It doesn't look too historical to me. And I want to go back to 117th Street, another historical building, which you had no problem, not you, Mayor Summers, but leveling to do what?
Which building?
The Cleveland Trust Bank. Beautiful inside and out.
I think that's the Walgreens.
Yes, exactly. We got a drugstore out of it. We really needed that drugstore. Now, there's one other key important things. At the last meeting, I talked about me going into the emergency room and how filthy it was. I want to know, does the health department come in there and inspect that hospital?
They do.
Well, they sure aren't paying attention lately. Okay, and there's another thing. I want to get this cleared up. Doesn't the hospital own over 14 properties on St. Charles and Bell? Don't they own these?
There's several residential houses. I'm not sure it's 14. I think it's 6 or 7 residential houses on St. Charles and Bell. That's correct.
So this is money coming into the hospital, correct?
That's
you
correct.
rent that out.
And those properties will be under the control of the city as a result of this deal.
Well, what about the ones from Marlow, which I said all the way on Detroit? You have 5 empty storefronts plus the apartments. That has been, this money has been not coming in for over 11 years.
Those likely would be demolished in favor of the new development.
Thank you.
Is it Mr. Horwick?
Robert Horrocks, yes. Good evening, and thank you for having this forum. Thank you for coming out and talking with us this evening. One question I had on the free cash flow chart, we had positive free cash flow in 2013, a negative 200,000 free cash flow in 2014. We're projecting positive free cash flow in 2015, and then it goes to negative 16 million, negative 32 million, and negative 32 million. I want to know why the free cash flow will turn so negative so quickly.
Fair question. Lisa, do you want to
Yep,
take that one?
so we did that projection based on the volume expectations of the hospital and, the impact that we think the opening of that new hospital in Avon will have on Lakewood.
Okay, thank you. I don't necessarily agree with that cash flow projection. We had our best investment year in recent years for the Lakewood Hospital Foundation. We got over $5 million on the last 990 report for annual increase in investment return. I'd like to know why can't we just simply continue to use that to fund shortfalls in the hospital operating?
I'd like to address that. Ken? And I would say at some point, the healthcare system has to invest in its future. It requires capital investment, technology, infrastructure, space. And that $50 million that's been protected and harbored for the right kind of investment must go into use, and it wouldn't be available for investment. So there's a trade-off here of investing in the new, losing the investment capacity, and getting a return on investment in terms of better health. That's really the goal we're looking for. Ken?
Let me just be sure we're talking to the right set of numbers. You're referring to the Lakewood Hospital Foundation?
Yes.
Okay. So the Lakewood Hospital Foundation assets are split in 2 categories. One are unrestricted, and the other portion is restricted. And those restricted are by donors who have identified specific needs or programs. Those don't include funding operating deficits. Those are to support various programs and services or purchasing equipment in the past, and also in the past supporting capital campaigns. I think in the last 10 years, we've contributed, the foundation has contributed over $10.5 million. Lately, most of the support that we've been providing are more outpatient-based services and programs. So again, there's donors restrictions on a significant amount of that money, and again, those are specifically earmarked for programs and services, not deficits.
Fair enough, thank you. And then also, I just want to make a statement. Once these jobs go, they don't come back. And you can't just have a pie-in-the-sky agreement that, you know, the clinic's going to build this nice facility. We might employ 150 to 200 based on what the clinic feels are market conditions at that time. We lose the 700 other employees. Those families move to where they can find new work. And then we have 4 acres of developable land, but we cannot sell that to UH. We can't sell it to Metro. We can't have any other entity come in and build a competing facility.
On that site.
Yes, so those jobs don't return. And that's a bad business decision for Lakewood and the people of Lakewood. That's my
Well, good news is we successfully attract jobs regularly, but 500 is a big number. We don't do it at 500 a crack. We have companies that have moved into Lakewood with 3 employees that are now at 25. It's actually a high-tech company right at the corner of Warren Road and Detroit. We have companies that moved here from Westlake that brought about 15 to 20 jobs, and now they're at 30 and 40. So the reality of it is we're going to have to make that gain by filling up Lakewood Center North. You could actually put 500 people in that commercial office. We need to work hard to get that building filled. We do have opportunities to create other jobs here in the community, 1 at a time, 2 at a time, 4 at a time. We have to create opportunities to do that. We have to create the conditions to do that. And we have a lot of folks who do want to live here. And we have a lot of folks who want to invest here. Actually, when 4 acres of land in Lakewood emerged as a possibility, developers all over the region started circling around here because they want to be here and they want to create. We don't know what that needs to look like yet. We're going to have that conversation. But I think we have to work hard to create and replace these jobs. It's no small task, but it's not impossible. Tom, and then Dr. Molino, and then we're going to end with a preview of December or March 10th meeting. Tom Fuller.
Hi, I'm Tom Fuller. I'm a primary care internist. I've been working for Metro for the last, since 1975. And I've been living in Lakewood since 1982. And I value Lakewood Hospital as taking care of such incredibly sick people as my brother-in-law, who's quadriplegic, who's been there as an emergency several times and taking superb care of. My ex-next-door neighbor, who moved from one location to another in this city, is currently in the hospital with pneumonia. So this is a very valuable resource that we have. Incidentally, she's the daughter of one of our ex-surgeons at Lakewood, who will be turning over in his grave to see what's happening to the hospital system now. My question is, however, regarding the financial statement you put up. Can you put up that $120 million again, please? $120 million investment. Now, my understanding is the top 2 numbers are coming from the Lakewood Hospital Association. Is that correct? So that's not an investment from the Cleveland Clinic. Ongoing payments are which payments from the Cleveland Clinic?
That's to the foundation. I think that's the $8 million.
That's to the foundation. That's not to the Hospital Association?
Right. The first 2 line items are being funded off the balance sheet of the Lakewood Hospital.
So therefore, they are our assets.
Yes.
Yes.
Those are part of the assets of the Lakewood Hospital Association. Correct. And that 33 that you saw, that's what I was referring to. That was used to estimate that.
I remember that, but there are assets that are paying for that.
Correct. The ongoing payments, the $8 million, that's the additional $500,000 per year for 16 years from the Cleveland Clinic.
From starting when?
Starting, I think, a year after the 2017.
Okay.
Thank you.
So that's from the Cleveland Clinic.
That's from the Clinic. The next
and
line
then the
item,
8.2 would be, if that's an appropriate appraisal of that property, would be from the Cleveland Clinic.
Correct.
So that their investment would be 34 plus 8 is 42 plus 8 is 50, roughly. And they would be investing in something that they totally own, not in something that we have any interest in anymore. We could only buy it back from them. So basically, we're giving away our asset for a total of 50, not 120 million.
The cost of the 24 million is for the future of the community.
That's our money.
Yes,
They're not providing us that money. My point is that the source
Absolutely.
of this 120 million investment is that 50 million of that is our investment.
Yes.
Correct.
And not the Cleveland Clinic investment. So I think we ought to, when we're talking about what the Cleveland Clinic is investing and what they're getting, we ought to be very clear on that and not put it all up in one slide that makes it look like they're investing 120 million in our community. They certainly are not.
I don't think that says it's all Cleveland Clinic.
No, I understand it doesn't, but it's been implied that. Cleveland Clinic, I've been working for Metro, as I said, for the last 40 years almost, and the Cleveland Clinic has not ever been interested in taking care of poor and underserved patients at all. And what they have done is they've taken secondary care and tertiary care only of these patients and sent them back to Metro for primary care. And this is over and over again. We'll get somebody who was put in the hospital at the Cleveland Clinic. They did heart surgery on the patient. When it comes to monitoring their blood anticoagulation, they send them back to a primary care doc. We get enough of the benefit of the secondary and tertiary. So they take the cream off the top for themselves, and this is their characteristic all the way throughout. And because our community is, not through any fault of anybody here, but because our community is acquiring many more poor and underserved, we're in a problem with that because the Cleveland Clinic certainly is not likely to take care of these people at their outpatient center. Second of all, if we look at what the poor and underserved can offer us in the future, if we have our own facility here and we would take care of them, Obamacare is providing a substantial cushion for many people. Look at the Medicaid that has been extended even by our Governor Kasich so far. And these could provide substantial funds so that we could actually have a totally different projection in terms of what would be capable in Lakewood with our 50,000 of our own people and the 100,000 surrounding. And we might have a viable institution that way.
Dr. Molino, and then Dr. Jones will close with a preview of the March 10th meeting. Dr. Molino?
Right. Good evening. My name is Marcelo Molino. I've been practicing at Lakewood for about 30 years. I no longer am in practice. And I have a couple of comments first and perhaps a couple of questions. Sorry. The question, I've heard the word demographics a few times. And right, there have been some significant demographic changes in our community. The key demographic change that has occurred, which I've never heard of, been mentioned either here tonight or at the Beck Center, it's no rocket science, very simple. It's a tremendous physician demographic change of what we have seen at Lakewood Hospital. Meaning, Lakewood Hospital 20 years ago when the clinic came on board, 20-some years ago, was a very viable, very strong institution. We all know that. We all remember that. I'm not going to make names, but we had a number of outstanding large practices of physicians totally dedicated to Lakewood Hospital. These people over the years have retired or passed on, unfortunately, a few. And there has been no attempt, for whatever reason, I'm not going to argue as to why yes or why no, but somehow we have never made any attempt to successfully replace these physicians. Now, these doctors have left their practices. How do we bring patients to the hospital? We have two main sources. One, ER. As we know, we understand the implications here. And two, the doctor sends them to the hospital, or the patient knows that this doctor is going to be there, so he's not going to go somewhere else if he knows his doctor is there. Now, 1 + 1 = 2. If the patient, someone living in Lakewood, knows that his doctor or her doctor no longer works at Lakewood because it's no longer there, no one came into the practice, and those practices have been basically dissipated over the years or gone somewhere else, where are they going to go? Somewhere else. So the physician demographic has been a huge problem, which we've never addressed, and I'm not going to say whose fault it is, but we've never heard of it, we've never talked about it. It's a very important point to keep in mind. The other question that I like to understand, yes, the demographic of the population in our city. And it appears that we are now filled with yuppies, 20-something. I wish we would all walk through all our hospital floors And it just takes one day, one shift, to realize that the mean age of our patients sitting at Lakewood Hospital today, right now, it's not going to be 25 or 35, but they're going to be 75, 85, or 90. So our demographic is what it is, and I've questioned about the prevention, the primary care, or the prevention, I should say. Primary care is very important, but the prevention plans to really change their outlook as far as healthcare. Great. One of the questions that I have, I've heard about only 2,000 people, I said 4% of admissions coming to Lakewood, I guess last year perhaps?
2014, that's
all
correct.
right, who lived in Lakewood.
Who live in Lakewood, that's correct.
So I'm a terrible mathematician, but it breaks down to 6 people per day. Now, I have a hard time believing that it's only 6 patients, 6 individuals sitting at a Lakewood hospital with a Lakewood address any given day.
No, so.
Hard to understand.
So I think the 6% number, so there's a couple different numbers I think that have been thrown around
right.
in various meetings. So one is if you look at the patient encounters, in and outpatient encounters, from people who live in Lakewood at the hospital, 6% of those are inpatient and 94% of them are outpatient.
Right.
So that's one number.
Well, I'm going to that number. I mean, the 6% boils down to 2,000 people. You just mentioned it. Right? So it's 6 patients a day, 365.
Okay, 2,000 people, yeah.
6 people a day.
Yeah.
We should.
Right, exactly, yeah. That would depend on what the average length of stay is.
I think there's about 43,800 patient days on average in Lakewood Hospital. If you take the 2,000 times 3 days, you'll get you the number.
My point is that I just have a hard time believing this number. But anyhow, well, I don't know how you guys come up with all these numbers. I mean, it's easy to turn around, etc. But it is sort of interesting perspective. There's so much we can talk about. I'm not going to go into all sort of discussions, but it's a very interesting set of meetings. I think the future is not too good for our community from a health point of view, I think. I had heard about Lutheran and Fairview as being our options. I've worked at Lutheran. I'm very close to Lutheran, but I don't think Lutheran is going to be a real option for our inpatient care for people who live in Lakewood. So basically, we are talking about going to Fairview. So hopefully, we can establish some sort of a transportation mechanisms. But
we'll figure that out.
You better move in a hurry because it's going to be a close call many times.
By the way, one anecdotal point before I turn it over to Dr. Jones. Are we ready for his
Thank you.
slides? Okay. Back in 2011, when I walked in the door as mayor, there were about 4 major external forces that I thought were threats. This was one of them. And I needed to learn a lot, and I needed to learn it fast. So I made an appointment to meet with Sister Judith Karam, who at that point ran St. Vincent's Charity Hospital, to find out their interest in engaging in the future of Lakewood Hospital. And her question to me right off the bat was, can you deliver physicians? And I looked at her and said, I can't deliver anything. I'm a mayor. I don't know what you're talking about. And what she knew, what I subsequently learned, is exactly what Dr. Molina was referring to. In order to actually deliver healthcare, you need physicians. And so for an external party like St. Vincent's to come to Lakewood, they don't have any extra physicians at St. Vincent's. They would need physicians to be there because they don't have enough of their own. And so I met with Paul Tate, who's the Chief Strategy Officer at University Hospital. This is also in 2011. And he diagrammed the fact that there's about maybe 4,000 physicians in northeastern Ohio. About 2,000 of them work at the clinic. About 1,500 work at UH, and 500 work at Metro and other places. So whatever you're talking about, you're carving up a pie of about 4,000 physicians. And so one of the key challenges is, in fact, how you deliver physicians. And one of the elements of this proposal is that 16 residents will move from Fairview Hospital to Lakewood. These are medical doctors in resident training for primary care. And they will bring their primary care practice to our city, plus they have 3 supervisors, I believe. And they will help add the additional strength here. And clearly, adding physicians and where they come from is a major question for every healthcare system in the country, especially at the primary care level. And we have Dr. Carl Cully, who's one of the trustees sitting in the back. He's a primary care physician here in Lakewood. He understands the Lakewood question. We don't have enough Carl Cullys in the country, and wish we had more. And one of the challenges is how we're going to get more. And we're not going to solve that tonight, but it is a major constraint of our strategic options. So let's conclude. Dr. Jones, March 10th, Tuesday, 7 o'clock in this room.
Can I just have 1 second there?
Sure.
Just one more point of information that I'd like the residents to end up receiving would be specifically talking about the economic impact of the 1,018 employees. How many of those do live in Lakewood, and how many of those would be divvied out to the other clinic hospitals? What would the likelihood of, or what the percentages would be that they would be offered to those?
Yeah.
Is that a number that we
Yeah, I
can end
think
up going
Shannon,
to, like
isn't that about 130 or something?
197.
197 live in Lakewood.
Okay, 197. And do we know what that economic impact is? Is that something that the Notice Center down at CSU can end up pulling together for us?
Well, I guess the question of what? Do they get a job, live here, and
I mean, how many of
somewhere else in the
them?
clinic?
Yeah, I mean, what's their income level? You know, there's going to be property taxes as well as income taxes that will end up lost by the city.
Well, you're assuming they're going to leave. They may get a job in Fairview.
Yeah.
Some of them, they may get a job at Lutheran. They may get a job in the new health center here.
Okay.
Those are unknown at this point. But
Okay.
as they become more known, that would be a fair question.
Okay.
All right, Dr. Jones, now, March 10th, we're going to hear in more detail what happens in a family health center. Dr. Jones, Dr. Stephen Jones, oversees the Cleveland Clinic Regional Healthcare System, and he will lead, along with his colleagues, on March 10th, of what exactly happens and how we do it. So this is a preview. Dr. Jones, thank you for being here.
Thank you, Mayor Summers. It's my pleasure. Thank you all for your comments and questions tonight to help us form a brighter future. And actually, Mayor Summers, my title actually importantly is the President of our Regional Hospitals and Family Health Centers. And the reason that title is important is it ties into really what our role we see in playing in the future of healthcare in Lakewood, which is our family health centers. And in the empty circles there, you see a number of places around Northeast Ohio where we have family health centers. And there's been, I think, a little discussion on what is a family health center. I'd like to at least give you an idea tonight of what we'll bring back to you next month on March 10th and be able to explain to you in detail, answer your questions, bring you people who actually work in the family health centers, actually including myself. And so what you see there, though, is that one place where we've not got a large family health center where most of the care in Cleveland Clinic is currently being delivered is actually here and around your community of Lakewood. And that's what we plan to put in place. And so these are photographs from our family health centers. And I would emphasize that I'm a urologist. I'm a urologic oncologist. I treat prostate cancer. And early in my career, most of those patients were treated in a hospital. And at this point in time, almost all of my practice is in one of the family health centers. And I practice in a number of these around the community. And we will be putting in place what we believe will be the most futuristic of these, a place where we'll have a living lab for us to improve our care for all communities. Comments were made on our desire for primary care. Mayor Summers pointed out we're bringing actually a crown jewel of our organization, the Center for Family Medicine from Fairview Hospital, will be moving here. And a big part of their focus is indeed taking care of our most vulnerable populations. So that will be here in innovative care, including basically a patient-centered medical home in a primary care setting. Concerns were raised about care for children. And actually, we know that very few children are actually cared for in a hospital these days. At the time of the discontinuation, 1.5 children at a time, per day were in the hospital. By contrast, obviously hundreds, if not thousands of children need to be seen in a family health center, and that will be part of the family health center that we're bringing here. There will be diagnostic procedures, the things that people are currently going to a hospital for. Most of those things, except for the inpatient care, in other words, the patient who has to be in a bed, will actually be in those facilities. And these are the specialties that we right now plan to bring in. But the discussion may indeed reveal that we need other services to be here. That's actually what we want to be able to figure out in fulfillment. The last issue is a freestanding emergency department, and that historically emergency departments have been in hospitals, of course. At this point, actually what we see is that we take care of in our freestanding emergency departments, and we've got several of these around Northeast Ohio, patients would come there just as if they were coming to an emergency department at the hospital. Now, if they're critically ill, so the example earlier of a major trauma would go straight to a trauma center, of course, but the overwhelming majority of patients actually would come into a freestanding emergency department, and you see photographs here. This is obviously a big deal program that we're able to provide. And I would bring up that, here at Lakewood Hospital in the fourth quarter of 2014, a little over 1,000 patients came in and went into the hospital. But we also have the majority, the overwhelming majority of those patients are actually what we call treat and release. They're seen, they go home. Probably many of you have experienced that care here. Well, when we look at that at Lakewood Hospital, what we see is that our brand new freestanding emergency department, which is in Brunswick, so basically, essentially what we're talking about putting in place here, they've been open for a little bit over 6 months. In that period of time, between the treat and release in the emergency department and our walk-in clinic, which is a complement, so someone mentioned earlier express care and urgent care, that we're actually seeing more patients than are being seen here in the emergency department on a treat and release basis. And so that's the care that you're getting right now. And we foresee this being able to provide that care not only now, but in what we believe is going to be a substantial future. So we will be coming back to that at our next session. We'll be devoting, I believe, most if not all the session to that. Sure. And we look very much forward to that discussion.
Yeah, and thank you, citizens. Thank you, Dr. Jones. So March 10th, we'll also begin the discussion of the foundation. So we'll spend most of our energy on learning what a family health center looks like in Lakewood. We will then begin a conversation about the foundation. Now, trustees, if you would be so kind as to come forward. If anybody has additional questions that they want to ask, the trustees will be up front. And we'd be happy to engage. So thanks for being here tonight. It's an important conversation, and we'll see you on March 10th.